Sleep is such a huge topic, and there's new science and data coming out all the time, and it's really fascinating. And that's why it's so important that we have sleep experts who study sleep so that they can help us have a better understanding as well. And to help us dig a little bit deeper today and get the latest on those sleep questions that we all want to know more about, I'm joined by sleep expert Professor Jason Ellis. Hi Jason, welcome.
Hi Zoe.
Hi. So I'm really excited for our conversation because there are so many things that we can discover that are new about sleep, and you know about all of it because you're our sleep expert. So to give people a bit of context about your sleep credentials, you're a professor in psychology at Northumbria University and director of the Northumbria Centre for Sleep Research. So you definitely know your stuff. So for anyone who is struggling with sleep, hopefully we can answer some burning questions they might have. So let's start off then with, why is it that some of us struggle to sleep and some people don't?
It's a great first question, and I think that we need to think about the biggest impact on our sleep, which is aging, actually. As we get older, the parts of the body, the internal system that really regulates our sleep, which is the body clock, the circadian rhythm, and then there's the drive to sleep, which makes us more and more tired. Both of those start to degenerate slowly and over time, but they actually do degenerate, which makes us a lot more vulnerable to not being able to sleep well.
Okay. And when you say as we get older, what sort of age does that start to kick in?
Okay. It starts around the age of 25, believe it.
25?
Yeah.
I thought you were going to say maybe 65 or 75. Wow, okay.
It's very small increments, but we are seeing reductions in the amount of melatonin we produce, for example. The amount of deep, refreshing sleep that we get. Year on year, they decrease a little bit.
Okay, really interesting. How long can we cope with poor sleep before it starts to have a significant impact on us?
Well, I think we've all had the odd bad night.
Yeah.
And the next day we're a little bit more moody, a little bit more irritable. Probably not going to use please and thank you as much. But actually, the system can correct itself, and it will correct itself. When we start talking about the long-term impact, it's poor sleep over months that we're talking about here.
Okay, and that's often down to the environment, isn't it, now, where we have mobile devices, we're working longer hours, and maybe the opportunity to sleep is not as good as well.
Well, we also got to think about culture. You know, we've got terms that permeate our culture. Snooze, you lose. I'll sleep when I'm dead. The value of sleep and its ability to correct itself actually is lost in that mix.
So if people say have sleep issues for a week or two and then it gets better, would that be all right, or what's the sort of timing?
Generally, if we're talking about stress-related sleep problems, 1 to 2 weeks, that's a normal adaptive response to the stress. You've got a lot more cortisol, a lot more adrenaline, and that's just keeping you awake longer, just so that you can try to cope, problem solve, work out solutions. Once we go over that 2-week mark, those hormones shouldn't really be impacting our sleep anymore.
Okay. Tell me a little bit more about the term sleep anxiety, which I've experienced myself actually a long time ago, where you persistently can't get to sleep, and then you start to get very anxious about not being able to get to sleep, and the problem sort of gets worse and worse.
The vicious cycle. It's interesting because there's a theory around this that we start out when we stop losing sleep because of stress, it's because of the stress. And it could be a positive stressor like a wedding or something nice, but it's still going to keep us awake. After about 2 weeks, we might see this switch point where the stressor stops you from sleeping and suddenly the sleep becomes the stressor itself.
Yes.
That's what we talk about in terms of sleep anxiety. And there's some really new research actually came out earlier this year, which demonstrates that is the single biggest factor, the sleep anxiety, which makes us go from just a few weeks of sleep disruption to having chronic insomnia.
Wow, fascinating. So it's actually then this worry about getting to sleep is the issue that's preventing the sleep.
It's self-perpetuating.
Yeah. I think there'll be lots of people listening to this who are thinking, that sounds familiar. How do we know when it changes from struggling to sleep, so disordered sleeping, to actually becoming a sleep disorder, such as insomnia?
Yeah, so when we generally define insomnia, we're sort of talking about 3 months in duration. That's the clinical definition. But actually, after those 2 weeks, something's not quite right and we should be going in and intervening early.
Okay, okay. That's interesting as well, because I think a lot of us don't, do we? We let things get worse and worse. A lot of people fall asleep fine, but they suffer sleep disturbance, waking up regularly through the night and struggling to get back to sleep. What's going on there and what can they do?
So this is part of the entire sleep process. If we think about sleep, we sleep in 90 minutes cycles as adults. And during that time, we're going through stage 1. And that's the point at which we're having that transit between being awake and being asleep. You know, that nodding dog behavior that we
when you're on
might
the
get?
train and you, neither in or out.
Exactly. And then you might experience something like you've stepped off the pavement too quickly.
Yes.
Yeah? It's called a hypnic jerk.
Right.
And what that is it's a way of trying to get rid of any excess energy that you've got, creating a nice, smooth transit into the official onset of sleep, which is stage 2.
So it's normal then, so that should happen?
Yeah.
Okay.
It's just, you may have experienced it. You have the jump,
Yeah.
but then you go,
It's a relief, isn't it? You have the jump, you're like, I actually haven't fallen, everything's okay. You take a sigh and then you go to sleep.
that's exactly the passage from being awake in stage 1
Okay.
to going into fully sleep in stage 2.
But I don't notice that I always do that. Is it that sometimes I'm not aware, or?
It may be sometimes you're not aware, you're very sleepy, or it might be that there's not a lot of cortisol left in the system to create the actual physical jump per se.
Okay, fascinating. So interesting. It's 90-minute cycles.
Yes. So we get vulnerable to waking up every 90 minutes. You finish a cycle before you start the next one. So those create vulnerability points. For most of us, we'll roll over and we'll go back to sleeping. But if something happens, we need to go for a wee. We might have a hot flash, our pain medication might be wearing off, or we might indeed have pain. That's enough of a window to create an actual awakening.
Okay.
Those are normal, they're natural. The issue becomes, can you get back off to sleep after you've dealt with it?
Right. So waking up in the night, especially if there's a reason, is okay. And that's why you shouldn't start looking at what time it is or stressing about being awake. You just need to deal with whatever you need to deal with and just get yourself back off to sleep.
That's exactly the thing that feeds into that sleep anxiety that we're talking about.
Yeah. Are some of us just naturally early risers and some of us actually true, genuine night owls? I kind of know the answer to this, but tell us.
Yes, we have something called chronotypes, and this is people's performance, whether they're really good performing in the morning or good at performing in the evening. There's a huge amount of people who actually sit in the middle that we call intermediate types, and they have a lot more flexibility. But what we see is if we take those people who are very morning oriented, our larks, and we put them into an evening situation, they don't handle it terribly well. Similarly, if we took somebody who's a real extreme owl and we made them do stuff in the morning, again, they're not going to perform as well.
But there are pros and cons to both, are there? So if the world is really set up for people who function well in the morning, isn't it? Because we tend to have to get up and either go to school or go to work quite early. But are there some I believe, and you can let me know if I'm wrong, that people like me who are night owls, we adapt better to shift work and we adapt better to jet lag?
Absolutely. So yes, the world is set up and it's all preordained around the morning, isn't it? It's work time, it's school time, it's getting things ready. And that's part of a culture that we have, whereas evening is a lot more flexible. You're absolutely right. There are some benefits around being able to adapt to changes in your body clock if you're more evening oriented. And so you have that extra flexibility that might help you work better in a shift work environment.
Yeah, well, that makes a lot of sense to me. So I wanted to ask next about the different stages of sleep. So you mentioned just then about the first stage of sleep, which is this transition state, which can end with a jerk.
Yep.
So is that stage 1?
That's stage 1. The actual jerk is the transit into official sleep, which is stage 2. Stage 2 takes up about half of the whole night. We ignored it for many, many years. But recently we've started to understand that it's got 2 main functions for us. The first is it allows us to review the day to determine, what do I need to keep? We expose ourselves to a huge amount of information. Sights, smells, tastes. Do we need all that information? Probably not. So we're determining, what do I need, what do I not need, so that I can turn the things I do need into long-term memory later on.
Right.
The other part of stage 2 is what we call a sensory gating mechanism. It's a posh way of saying keeping you asleep.
Right. Okay.
So we just use the example of pain. People have pain, or maybe the neighbours, they've left the television on, or they might be having a row. It's in our interest to stay asleep. And so our brain will actually create masking so that it says, don't focus on that, focus on the sleep, stay asleep. It actually gates across those sorts of intrusions.
Okay. Wow.
Then we go from that into stages 3 and 4, or slow wave sleep. A lot of people will hear about it in terms of deep sleep. This is where we fix the body. The immune system, really, this is where it gets its main activation from. When you're not feeling very well, what do you want to do?
Sleep.
Exactly, because we want to get the immune system working.
Yeah.
The endocrine system, and that's helping us with our fertility, it's helping us with our eating behavior, it's helping us regulate all of those things around insulin. That tends to be also functioning and really efficient during slow wave sleep. The lymphatic system, this is one that's quite recent. It's our understanding that during slow wave sleep, we actually clear out toxins in the brain. And those are the toxins that have been associated with things such as dementia.
Wow. Wow. So the brain, a bit like the lymphatic system of the body, is it then? The brain's actually cleansing away toxic proteins.
Yeah, pretty much putting a washing machine right the way through the system.
Gosh.
We go from stages 3 and 4, slow wave sleep, we actually go back up to stage 2.
Oh.
Check the environment. Is it safe to carry on sleeping? Yep. And then we're allowed to go into REM, rapid eye movement sleep. This is where we deal with the emotional and the memory side of things. This is where we regulate our emotions. And this is where we consolidate a lot of our memories. So when we've not had a good night, for example, this is one of the reasons we are a little bit more moody, a little bit more irritable, or we might even get a little bit more hyper.
Yeah.
Because-
Or anxious as well.
Or anxious. Because what's happening during REM is we're putting a cage around our emotions and dealing with them, trying to keep them to really a nice balance so we don't go in either direction.
Wow. So stage 3 then is kind of about the physical body, keeping us alive and healthy, and stage 4 is about sort of our psychology, sort of keeping us in a good nick from a mental health point of view, which I guess is why we see such close links to poor sleep, short sleep, with conditions like depression and anxiety, right?
Absolutely.
Because if we're not getting enough sleep at the end, then we're not able to do that sort of repairing and taking care of ourselves.
Absolutely. It's slightly more complex than that, though.
Always is, isn't it?
Of course it is. This is why I've got a job. When we're talking about REM, it's how quickly REM comes in as well.
Right.
REM should come in at around 90 minutes in that first sleep cycle,
Yeah.
because it's the end. If it comes in too early, it's a really good sign that we're likely to become depressed in a few weeks' time.
Wow. God, it's so interesting, Jason, honestly. Right, anyway, I've got to move on to the next question. What about napping? Is napping good for us? And if so, why?
The first thing I would always ask about napping is, why do you need to nap?
Right.
If you need to nap, that's generally an indication that there's something wrong with the quality, the quantity, or the timing of the sleep that you're getting.
Right. Yeah.
Now, there are occasions where people will need to nap. New mums,
Yeah.
chronically ill people, of course they need to nap. But for the majority of us, why are we napping? Is it that we're sacrificing sleep somewhere along the way?
So staying up late at night working or having to get up too early.
And I mean, napping can be beneficial. And certainly in the context of learning, for example, we might want to ask people to have a nap after they've learned some information, because it will help them consolidate it, turn it into long-term memory. But we've got to keep it short.
Yes. How long can we nap for before it becomes more detrimental?
We talk about 10 to 20 minutes because after that, what tends to happen is we start a full cycle.
Right.
And if you think about it, the full cycle's 90 minutes.
Yeah.
If you wake up after 45 minutes, you're going to have 45 minutes where there's going to be a little tension. Your body wants to finish the sleep cycle, and you've got to attend to something in the environment. It's what we call sleep inertia. Right. You know that groggy, awful feeling
so
we
you end up
get?
feeling worse for it.
Yeah.
Okay, that makes sense. What about dreams and nightmares? Are they a sign of good or bad sleep? And is remembering them significant?
Well, it's interesting. we've started to understand a little bit more about dreams, but it's still an area that we don't know an awful lot about. What we do know is that if you remember a dream, you've woken up. So that's the first indication that it might not be the smoothest transition from being asleep to being awake. We should be finishing a sleep cycle perfectly relaxed without being in a particular stage. We should be in that zone.
Right.
So if you're remembering dreams, it means that you've woken up during REM.
Right.
We know that we have REM dreams throughout the night, but we can actually dream outside of REM itself.
Oh.
If we're dreaming in black and white and it's a lot more concrete, tied to the world, then it's a non-REM dream.
Okay.
The real fantastical, colourful, beautiful dreams that we have, or horrible nightmares, they're more REM-based.
Okay. So if you have a lie-in in the morning, which I know we're not really meant to do, but if you do, that's when you have those more concrete dreams.
That's right.
That's when you probably shouldn't be in bed anymore,
Absolutely.
is it? Okay. And you start sweating often as
Yeah.
well. Yeah. All making sense. All right. Final question. Is there any evidence behind white noise or brown noise being good for sleep?
There's a lot of anecdotal evidence. Let's describe what white noise is.
Yeah.
Have you ever turned the television on and it's got the
Yes.
in the background?
Yes. Well, not anymore, but back in the olden days.
Back in the old days.
Teletext.
Or if you really wanted to go and listen to your fridge,
Right, okay.
that low humming noise, that's white noise.
Right, okay, yeah.
And then we get lots of different variations which call different colours. So brown noise, we might think about taking our fridge to the river with us.
Okay.
And so it's got a little bit more depth in it. And then we've got pink noise, which actually is more rhythmic.
Right.
And that's why it's very often used in the context of babies, simulating the womb.
Right.
Is there evidence? There is some evidence, largely anecdotal, but there are a couple of studies which have shown that it's quite beneficial to use white noise in the context of not being able to sleep, masking out other noises from the environment. The partner who snores, for example, some people do use white noise effectively.
Wow, thanks, Jason. We've covered a lot of ground there. I wish we could keep talking about it all day, and I hope you found that interesting too.